Sitara Spa and Salon for all your beauty needs. Excellent customer service for hair and makeup for all special occasions. Specialize in eyebrow threading, waxing, and facials in a clean environment. Separate rooms and clean equipment for every service. Experience stress-relieving scalp and shoulder massages. Best organic products and services. Special discounts for all special occasions. Offers training for a minimum fee. For appointments, call 703-955-7763.
Namaste Piluputv viewers. This is Sunita and you are watching NRI Voice. Among the many health issues we face today, one of the major problems on the rise is stress and anxiety among adults and kids, which is affecting everybody at the same level, because what they face in day-to-day lives, kids and adults are facing this problem everywhere. As part of Pilupu TV's community service, we have today 3 board-certified doctors with us to discuss more about this issue. Welcome Dr. Hema Mukhara. She is board-certified in adult and child and adolescent psychiatry.
Thank you.
And welcome Dr. Swarupa Isnapla. She is board-certified in internal medicine.
Thank you, Sunita.
And welcome Dr. Reena Bomasani. She is board-certified in family medicine.
Thank you.
Thanks for gracing Pilupu studio today. And thanks for sharing about to share your knowledge about a lot of facts today. Welcome to Pilupu Studio. So, Dr. Hema Mukhara, tell us more about the problems we are facing in the current day society. These kids having to face this depression and stress and anxiety. So, can you throw more light on this problem for us?
So depression and anxiety is a very common condition that we see in a lot of children and adolescents. And there's a lot of stress with the societal expectations, the education, and other pressures from peers, and having to deal with different expectations at different levels. So again, the sadness is just an emotion. We are not treating emotion. When people come to us, we are really looking at a set of symptoms, which we call it as depression, that is causing social, educational impairment, and basically a functional impairment. And
what do you think this is caused by? What's the root cause for this problem?
So when you look at the etiology, which is the cause, basically a lot genetic factors do play a role, and a lot of psychiatric conditions are multifactorial, which means genetics do play a role, but there is other factors like the stresses from the situation, social aspects, and different other factors also play a role.
So it's a culmination of a lot of things happening in a kid's life that will ultimately lead to depression or anxiety. Is that what you're saying?
No. The thing is, like, if a kid is genetically prone to depression, how they deal with the situations and stresses is going to be different. So again, when we have the adequate social support and adequate help, to some level the kids are able to outgrow that and they're able to get through it. But when they don't have that support, you kind of see them go take a downhill course, and you'll see all, there's a concern for safety, suicidal thoughts, and things like that comes into place.
Okay, thank you, Doctor. Dr. Swarupa, what's your take on this?
See, I would say the most important thing is recognizing, the problem with the child or even an adult. Seeing, what is the change? What is the child changed from before? And recognizing the problem is one of the most important and critical steps towards, correcting or towards managing the child, illness. And the next important thing is keeping the lines of communication open, in case, if it's the spouse or the child, and talking to them and encouraging them to say how they feel, and seeking help, when there is a challenge. Don't feel it as a stigma. Don't feel that it should stop you. Go see your doctor, go see your primary care physicians. That's what we are here for. Go talk to them and they can try to take care of it. And if it's beyond, their management, they can refer you to a specialist like, the psychiatrists that we have who can address the problem. So I would say the most important thing is recognizing the problem, keeping the lines of communication open, and seeking help. Knowing when to seek help too is a very important thing. Don't let the social stigma hold you back from seeking help.
Thank you, Doctor. And Dr. Reena would like to hear more about this.
Yeah, I think I would like to add to what Dr. Swarupa said. Basically, to have a very open communication with your child. And as a parent, I think it's very important to monitor your child to see what's going on in their lives and have a continuous communication. And when you are having a communication, you can actually identify those red flags that the children are exhibiting. But if there is no communication and everybody is busy in their own lives, that's where the problem comes. So I feel that you have to have that communication and always encourage your child to speak their thoughts. Not suppress them or not brush them off. Many times it happens that parents are like, oh, don't worry about it, that's nothing. But you should pay attention to what the children are saying and also talk to the teachers at school. Sometimes their performance at school deteriorates and we need to find out why. An A student cannot just suddenly drop to D. So there must be something that's going on, and collaborating with the school counselors, with the teachers, I think is very important. And then last but not the least is to bring it to your primary care's attention at the earliest. Any little thing, because the primary care doctors are able to identify these red flags and either get them counseling or do whatever, if they need to be referred to a psychiatrist or if they need to get started on medication. Like Dr. Swarupa said, please do not think this as a stigma. Mental health is pretty much like any medical condition, like a diabetes, hypertension, any illness. So
it's just a disease.
It's a disease.
And you treat it.
And you treat it and you pay attention to it. Don't think that it's a taboo and we shouldn't talk about it or we cannot suffer from it. Anybody can.
And to add to that, the important thing is when the kid is talking about killing themselves or wanting to die, clearly that thought process has gone in the wrong direction. So that is, when you hear those words, it's important to talk to the child more and make sure you at least take them to the primary care doctor first and get a screening done and look into it further. There are a lot of options before. Kids actually 70 to 80% of the times they ask for help before they commit suicide. A lot of times they are being ignored or sometimes parents don't take it as serious. They think, okay, they're just saying because it's just too difficult for them to handle. But I think, it's important they at least take them to the primary care doctor or a counselor and talk about it more and look into it more to see what kind of help they need.
Right, thank you, Doctor. Among the causes, our viewers want to know if overstimulation is one of the reasons for kid to drop into depression and anxiety and eventually causing the suicidal thoughts in them.
Like what do you mean?
When overstimulation is when I mean scheduling too much into their lives, like a ton of classes, not letting a kid be a kid. And we are raising, it's my personal opinion, but we are raising a bunch of overachievers where everybody wants to do everything. And this person is doing that person is doing, I have to do everything.
Right.
Is that in any way contributing to this stress and anxiety among kids?
So I think the important point to note here is trying to understand the parenting role here. It is important to challenge your child enough for them to be successful. At the same time, understand the child's capability and to be able to back up.
Limitations.
Exactly. So not challenging is also not a good thing because we want them to be successful in life. But when you know that the child is really struggling, you made everything that is possible to help the child to get through, but still the child is not able to do it, then I think it's important for us to kind of back off and say it is okay for the child to do something different they are good at or whatever they want to do. Because every brain is so complex and there's no perfect brain, there's no perfect child. And the kids who are good at certain things are not so good in other things. So the important thing as a parent is to not to push what we think is right or what we want them to do, but to kind of understand what they are good at and try to encourage that. If a kid is studious and academically doing well, that's fine. I mean, let him go to the highest level. There's nothing wrong about it. But if the kid is good in more artwork, or because the brain is different, and if they are good in other things, it's important to encourage that, that area instead of pushing them to the area that what we think is right for them to do.
Instead of pushing them to be something they are not,
Yes.
just nurture them and let them know what they are good at and slowly guide them towards that goal instead of making your goal theirs.
Yes.
Right?
Yes.
That is something that I really agree upon. With children, we need to give them the option to explore, what their interests are, and they will come up to you. They will, express, and they will be very clear what they are actually interested in, and try to empower them to make that as, if they're passionate about it, they're going to be successful at it.
Yes.
And I think we don't see that much in our community. Because practicing here medicine, we see a lot of patients from other communities like the Caucasians, the African Americans, and of course our Indian community. And we see, especially in my practice, I come across that parenting differences in all these cultures. Our community still continues to instill, this is what I want you to do.
Yes.
This is what my father wanted me to do. And I think, we need to change with time, and we're living in America, and the thought process needs to change.
Yes.
We need to encourage our children in what they are passionate about. They're not just two professions,
Yes.
like back in those days, medicine, engineering.
Mm-hmm.
There are a lot of options.
Yeah, basically, you need to let them choose what they want to be.
Yes.
Instead of you imposing your wishes on them or us imposing our wishes on them, we need to, get that thought process in them to choose for themselves and act wisely.
That's very true. I think we stress the kids a lot, take them to this one, that one after another. They don't have the time for themselves to think what they like, what they want to do, and we should encourage them in what they like to do and wait and see, the kid is going to blossom. It's not just that, if you push them in the wrong way, push them in a lot of activities, and they're not able to do it, they're not going to do it regardless of how the parent wants them to do. Instead, if you let them be what they want to do, they're going to blossom, do things very well, and you never know. Each kid has their own strengths.
Yeah.
And the important thing to remember is, like, when you are an adult, you should be able to look back and remember your childhood memories. If all you can remember is going to class after class and doing, competing with somebody and always packed with all the classes during the summer too, and never had a fun memory, then it's almost like you lost something that you can never get back in life. So it's so important to develop good childhood memories that you can cherish for the rest of the life. And I think those memories are really the most precious, and I'm sure a lot of adults will agree to that when you grow older.
Yeah. Right. What you're trying to say is have balance.
Yes.
Good
Absolutely.
balance makes it perfect.
Yes.
Right. Thank you. And we are hearing in news about suicide rates among teenagers and even younger kids. What do you think is the root cause for a child to even think about killing themselves?
As I told you, there are a lot of pressures. The social media, a lot of peer pressure, expectations, and sometimes the kid being asked to do things more than what they're really capable of, and being blamed for not able to keep up to the expectations. So these are different pressures. Again, there is a genetic vulnerability. Not every kid who goes through all these things is going to have those suicidal thoughts, but there is a genetic vulnerability which makes them susceptible to take a different course in their, in the way they think. And the important thing again to remember is, if the kid is talking about wanting to die, clearly that is not a right sign. And it is important to get help as early as possible to prevent those kinds of suicidal deaths. And again, the important resources would be school counselors. Actually, there are counselors who work with issues related to school, and the students can go and talk to the counselor and express their feelings and concerns and any of those thoughts, and they can take the appropriate action of contacting the parents and authorities, whoever they have to, in order to get the right help for the child. Because there were situations that we have seen that where the kid really wanted help, the parent doesn't want, because they don't want others to think that the kid is trying to get help.
Yeah.
So I think that should not
social
happen.
stigma.
Yeah, that should not happen, because if you lose your child, who is going to care about what others think? I mean, I think the child's life takes over everything. So it's important that we not worry about what others think, but try to get the right kind of help for the child. And the other resources, again, the kids, they themselves can call 911 if they clearly feel like they are not safe and they are imminently in danger. And it is really an emergency situation, and it is okay to call 911 if there's nobody to talk to and they feel like they are they fear that they are going to do something to hurt themselves. And again, they can definitely talk to parents, and if parents are not listening, which has happened in a few occasions, and if that is the situation, then again, the school, 911, these are different resources. Sometimes even talking to friends, and which may not be the best thing all the time, but I have some patients who came through friends and got help. So just communicating with anybody around them that they can trust and asking for help is the best way to prevent some of these things.
Yeah, and actually I wanted to add one more thing is the primary care providers, the doctors, play a very important role in families. So the parents and the family needs to have an established primary care doctor. Primary care doctors are actually, they can screen for depression. They identify this just by looking at the family, as a family itself. In just 20 minutes, when they go as a family to a primary care physician, internist or a family medicine doctor can pick up those subtle dynamics in the family and alert the parents. So regular appointments, physicals for children are important. So when children come to, nowadays the recommendation is actually 15 and above to screen the children for depression. So across the board in our office, we screen patients for depression. So whether they talk about it or not, we give them questionnaires, because this is becoming an epidemic now. Suicide rates are going up, depression and anxiety is going up. So as doctors, it's our responsibility to screen and take care of these issues. So that's the relationship I really encourage, that the community, every family should have a primary care doctor. You don't see a doctor when you're sick. You go see a doctor to make sure you stay healthy.
Right.
So that is, I really want to emphasize that. Then that would prevent a lot of these problems. Because if it's too late in the game, it's already late.
There's nothing much you can do.
Yeah, if the child has already gotten to the level where he or she is suicidal, it's too late. So we need to prevent that. And that relationship starts with the parents and as a family with the primary care doctor.
And also adding to that, in schools they have the
Yes.
guidance counselors.
Yes.
If a kid cannot approach their parents, they can always go to the counselors.
Yes.
So that's one thing.
Yeah, and that's very important. And I've received like notes from the school, counselors stating about the children, and that really helps, because it's a collaborative care, and we can really prevent all these major problems in suicide and all that.
And even to address the parents, some parents who are hesitant about medications, things like that, they need to understand, for depression and anxiety, the therapy actually works as well as medication. There are some the cognitive behavioral strategies which are proven to be effective, and they work as good as medication. And of course, when it comes to a certain point where the kid is talking about dying, things like that, we have to add medication, and it's a combination of medication and therapy at that point. And the studies have shown that when you combine medication and therapy, the success rate is even higher. But with therapy alone, you can definitely get at least 65% response rate. So there are methods by which you can get help. Not necessarily medication is the option all the time, but asking for help and taking care of it is so important. And there are also studies that have shown that when people have multiple episodes of depression, your chance of dementia is also higher when you grow older. So it's not just taking care of yourself for the moment, but actually taking care of yourself for the long run. So it's important to treat depression.
We talked about therapy and medication.
Mhm.
What about exercise, yoga, and meditation? All these things do help.
Yes, yes. I mean, definitely yoga is a science, and it is proven to help with anxiety, depression. It is a method of relaxation, and it definitely helps. And meditation and all those definitely adds value.
Okay.
Yeah, so when you exercise, actually, your body releases endorphins, and which actually calms you down. So it's a relaxation method. So exercising is really, really good. Regular exercise will prevent, some flare-ups of depression and anxiety, and help you sleep better.
Mm-hmm.
So you sleep better, you're not grumpy and not anxious, and so.
And
Yeah.
teaching, one thing I want to add is teaching the child or an adult the value of the self.
Yeah.
It's good to, get criticism from others, but don't ever be discouraged. Always know the value of yourself. And I think it's very important to reinforce and tell the kids, you are valuable as a person and you are able to achieve things and encourage them. In addition, help them, get them involved, like Reena said and Hema said, exercise, from a very young age, especially yoga, because it's good for the body and also for the mind. And meditation techniques, the sitting calm, they know how to stay calm, have control of their mind, which is very important in these days.
Control of mind and emotions.
Emotions, yeah.
Absolutely, especially at a young age, because there's a saying, that if you can't control them as a child, if you can't mold them as a child, as an adult, they're going to be very resistant.
Yeah.
So especially yoga, meditation, and exercise should be part of the daily regime, just like as we eat, sleep, do things. These are very important things, and you need to set up time, a certain time in the afternoon, in the evening when they come back from school, or even we as adults when we come back from work, just go do things you like, exercise, 10 minutes meditation a day,
Basically, take time for yourself.
That's absolutely, make time for yourself, There's no one that's going to look out for you. You're the person.
You are responsible for your well-being.
For your own health and mind, take time for yourself. Don't be pressurized. I got to do this, I got to do that. That mom does this mom does this. You got to, make sure that we are healthy and our family is healthy and the community as a whole,
So, Dr. Hema, you said something about genetic predisposition, having to do something with the suicide rate. So, my question is, if somebody in your family already, attempted or been successful in committing a suicide, do you have that red flag up?
Yes, yes.
So, in that case, what are the symptoms we are looking for, and how closely that family member is related to the child that it is effective?
I mean, basically, like in first degree relatives, like genetically, you have that genes passed on where you have the vulnerability to develop depression. Again, there's no. I mean, of course, like a completed suicide is a red flag. But basically, what I meant is, the genetic predisposition, shows that that they are vulnerable for depression.
And you would look for signs of depression, in a kid that enjoys, watching a game or doing something, all of a sudden the kid is not interested anymore. Or, like Reena said, his grades drop, or he likes to go play, he's not going out. Those are the signs that you would look for, and not enjoying the food they like, normally, and losing interest in things they like. Those are the signs that you would look for, and not sleeping very well, not sleeping, or, just waking up in the middle of the night. Those are all signs that you would watch out for.
So the typical melancholic depression is, they lose interest in things that they typically enjoy. There's a sense of empty feeling for them. They say, like, I feel empty. I feel like there's nothing to look forward in life. There's like a foreshortening of future. Like you feel like there's nothing, you cannot see your future beyond certain point. And then, basically again, sleep issues, not able to sleep well, and losing a lot of weight, low energy, lack of interest, all those things. There's a set of symptoms that together which kind of makes them not functioning, not function in school and also in, like overall like socially. We expect that to continue for several days, not just a day of feeling sad or feeling low. It's at least like several days of at least 2 to 3 weeks of sadness is what we typically look for.
So 2 to 3 weeks
These
of
are all
sadness
these and all these symptoms.
it can be named as depression.
No, at least 2 week period of all these symptoms that results in a social, like occupational or in any kind of functioning, school functioning. Yes, there should be an impairment in functioning with the symptoms for us to classify that as depression. So just sadness to a situation is not depression. We are not treating emotions as I told you initially. We are treating the functionality. So if these set of symptoms are making you not being productive and functional, and it's affecting your lifestyle, then it needs to be addressed.
Right. So, what can we do to prevent these kinds of traits like anxiety and depression among our kids?
I think the first thing is to make sure that we minimize the stress levels to the point, they have to take stress to what it is needed, but not beyond that. We have to understand what is the capability of the child and what they can do and challenge them accordingly. And I think that's a very important parenting role. And so minimize the stress from the academic aspect as much as reasonable. And also socially, I think a lot of stress these days is the social issues, the peer interactions, inappropriate peer interactions, and a lot of bullying issues. And I think the social pressure is probably the number one pressure for kids these days for a lot of this depression and anxiety that we see in them. So I think, I guess if there are red flags of any of the bullying going on, it's important for them to ask for help and communicate and take care of, because if bullying is not addressed, it will continue forever. So I think the kids should be bold enough to communicate with some adult about what is pressurizing them, so that we can prevent some of the stress, minimize. I mean, we cannot avoid everything, but we can minimize by appropriate communication and intervention.
Thank you.
I absolutely agree with Hema. The number one thing is don't stress yourself over anything. You're just a kid, be a kid, and do something you like, because that itself de-stresses you. And, don't be overcome by peer pressure or social media pressure, which is a big thing now. So my take home would be, don't stress yourself over anything. Just be a kid, do things you like to do, which actually positively reinforces the child and even the parent. And parents, don't let your dreams guide the child to what they want, what you want them to be. Let them be what they want to be, regardless of your dreams. Let them just do what they want to do.
My message, I think, would be mainly to the parents. Parents need to have time with the children. In this day and age, I feel that we're running and, just trying to, we're so busy, so occupied in our own lives. But taking that time to spend time with your children, to get to know them, observe them, building relationships with them is very important. And when we are there for them, they actually can open up and communicate, and you can seek help if necessary. Most of the times you don't even need to seek any medical care providers' help. Parents themselves can handle it. Parents should, especially our generation parents, I think living here in US, we have the way we were up, our upbringing was in India is different. The children that we are raising here, the US citizen children or the US born, it's different. Culturally, it's different. So it's a learning curve for us, but we need to keep ourselves updated. We cannot live in the past. We need to have open communication, open thinking, and always just try to build your child's personality. Never ever say things like, "Oh, you're a waste," or "You're good for nothing." These kind of things demoralize children. Building their personality and pushing them to the potential that they have is parents' job. And I think as parents here, that is a big challenge for us, especially our community, but we should do that. And I think we can really prevent a lot of these mental issues that are going on in our children.
You know, so as you said, the first support for the kids is the family and friends. So if we could build that good communication among the family members and have good supportive friends, I really think they can avoid a lot of these things and don't even have to go to the next level of asking help from from a psychiatrist or psychologist or even other places. But so creating that good network and communication and that support, I think, is important. But again, if in spite of all these things, if there are still issues that come up and they want help, they shouldn't be shy to ask for help. I think that is so important. And don't worry about others judging you. It's important, to take care of yourself. And I think that should be the key thing to remember.
Yeah.
So, doctors, I have another interesting topic. We can talk about this all day. As mothers,
Yeah.
so American born confused Daisy, so ABCD. So, what are we doing to our kids? Are we confusing them by maintaining little India at home and then them having to go out to school and act like American? So, what's your take on that?
I think it is important for them to understand some aspects of culture because if we don't teach them at all, they never will know that. But I think as a parent, we have to teach them. But whether they want to follow or not should be their decision. I think at that point we shouldn't be pushing them. But if we never teach them, they are never going to learn it. And maybe there are some kids who really like some aspects of it. And I have seen some ABCDs actually know more about all the cultural aspects than even kids in other places.
Than
So-
kids who grew up
In
back
India,
home.
right.
Yeah.
Exactly.
So,
So I think it's important for us to provide that option of letting them know, and then give them the option of whether they want to take it further or not.
right.
Yeah, so I just wanted to add the same, pretty much. It is definitely the mix between the East and the West. And like she said, Hema said that it's important for our kids to know our culture. So if we teach them our morals and our values, they are so, in them. So when they actually do get exposed to these cultural variations that come from the Western influence, they know how to protect themselves. We are not here to tell them what to do and what not to do, but we are here to empower them to make the right decision based on our morals and values. So I feel that instead of telling your child, do this or don't do this, I think it's important to tell them, you think what's the right thing to do in this situation, and empower them so that decision comes from them from within. And I've seen most of the times when you do something like that, a child makes the right decision. So instead of especially I'm talking about the teens, no matter how much Western influence or culture there is around, our kids tend to make right decisions because the way we have, trying to open communication, teach them the morals, teach them the values, and most of the times they're not confused. So we have, and that a lot depends on the mothers and the dads and the parents, the family. So again, it comes back to family.
I agree with both of them. I believe very strongly in family traditions and customs because that's the pillar for our own strength and our personality and characters that we instill in the children. At the same time, when they're outside, let them be what they want to be. Go along with the flow. Be a Roman when you're in Rome, but at the same time, get those positive things from your culture, your traditions, and help them build what your character is. And that way, you pick up good things from the Western culture, pick up good things from the East, from where we came from, our roots, and which both help you form a strong individual with a good character. But don't reinforce, don't make the kids one thing I've seen is with language, where we say, it's very good and very advantageous to be a bilingual, but at the same time, don't force them to talk a particular language that you speak at home. Let them talk what they're comfortable in, as long as they can communicate and they understand. One thing is you need to let them to learn, and you talk to them, because when they go back home and they meet their grandparents and cousins, it should be not be an impediment, because if they're able to communicate with them and know the tradition and cultures, when they go back home to spend vacation with the family back home, they will enjoy it. If they do not know the traditions, they're going to feel bored. At the same time, as parents, we shouldn't make them do too much of, or follow too many traditions. Just pick up the good ones, as long as they understand and communicate and the things get done. I feel that's how it should be.
Thank you, doctors, for your valuable information and the suggestions you made today. And it's really valuable suggestions for parents who are away from their homeland and how to protect their kids not to fall into a cycle of depression and anxiety. I thank you all for coming to Pilupu Studio today.
And thanks to Piluputv for having us here. I've been thinking about communicating this information to our community for a very long time, and this platform has been a great opportunity for me to be able to do that. So thank you very much.
And thank you for having us, Sunita and Piluputv. Thank you for giving the opportunity to, share our experience and even our medical knowledge in any way that can help the Indian community.
Yeah, thank you again. Thank you, Piluputv. Thank you, Sunita, for having us. And I think you gave us a great opportunity to pass on this big message to our Indian community and the NRIs here. So we wish that the audience, the viewers of Piluputv, take some points from us, from our discussion, and hopefully it has been of some help. The first thing that we want is to educate and create the awareness of this rising problem, the anxiety and depression. So again, thank you very much for giving us the opportunity. Thank you.
Thank you.
Thank you.